another person who has had trouble staying healthy lately is one Tiger Woods. Let's talk about it with Dr. Christopher Tucker, who joins us now on the Buyers Barricades guest line for the injury update, powered by the Sports Institute at TSAOG Orthopaedics and Spine, online at TSAOG.com. News broke earlier this afternoon. Tiger Woods, with a major injury setback, ruptured his left Achilles tendon while training at home. Did have surgery earlier this morning. With everything that Tiger has gone through, Doc, and the torque that he has when he swings a golf club, would his recovery from an Achilles injury be even longer because of the way he torques his body when swinging a golf club?
Yeah, hey guys, great to be on here. Yeah, I mean, gosh, what another challenge for Tiger. Obviously the professional golfer and the amount of torque he's generating when he's swinging, especially given, his other lower leg injury that's already kind of, compromising his baseline function. This is definitely going to be a challenge for him. It's obviously recoverable. Professional athletes are typically cut from a different cloth, so their ability to heal and rehab, obviously surpasses most mere mortals. But, this is certainly an uphill battle for him. Achilles injuries are pretty common in, middle-aged athletes. The blood flow to that area is definitely not what it was when he was, young and right out of college playing. So he's definitely going to be taking longer to heal from this than he would have if he had had the injury earlier in his career. But I think it's possible.
Doc, when he mentioned that the procedure that it was done described as minimally invasive. What does that mean compared to one that's not minimally invasive?
Yeah, that's a great question. His Achilles is the tendon in the back of the leg. We all kind of know where it is. It connects the calf muscle to the heel bone. And where it ruptures is usually, an inch or two up above from the heel, just because that's the weak spot in the tendon. So traditional methods of repairing this was what we call an open surgery. You'd have somebody take a knife and size over the skin, spread it apart, and directly look at the tendon and then sew it back together. And then you got to close up the skin and let it heal. This more newer age, minimally invasive surgery involves smaller incisions, basically sewing through the skin, through smaller incisions, no open, wide exposure. And the advantage of that is just disrupting the blood flow and the healing environment less. So you're achieving the same structural strength with the suturing, but a lot less disruption of the natural healing. So you can kind of get on the road to recovery quicker.
In outpatient, I mean, he said the surgery was this morning. He's already back home. Is that pretty common, or is that because he's rich and he's Tiger Woods?
No, it's pretty common. So most of these tendon repairs can be done as an outpatient. There's a lot of techniques we have nowadays, typically using a tourniquet, which is a pneumatic device that cuts off the blood flow to the leg temporarily while we do the surgery. It just minimizes the trauma to the area, minimizes the bleeding. And we also have improved anesthesia techniques where pain control for patients with these kinds of surgeries, or even joint replacements that used to be in the hospital a couple days, now you can have surgery and be home in a couple hours. So it's pretty common. It's not just because he's Tiger Woods.
Doc, I got to ask you, and this wasn't on the list, but I don't know how long you've been a doctor, but does it amaze you how technology just improves, it seems like, by the month?
Yeah, I mean, I've been a physician over 20 years now. I had a long career in the military and now in civilian practice. And as you said, the innovations and, the techniques, but also just the thought processes by those taking care of patients, athletes, anybody. It continues to amaze me. And, that's part of the thing that keeps you going and keeps you excited about getting up every day, learning, getting better, and, continuing to improve. It's kind of like a chef, learning how to make, the best possible, meal, and then, just improving your technique, and, all of a sudden you're a Michelin star chef. That's kind of how we look at it as surgeons. You just kind of every day you can always get better.
Wow. Michelin star cutter, Dr. Christopher Tucker, here on the Blitz with our injury update. And, while you think about the advancements, then you have, Tank Dell undergoing a second surgery to repair his torn ACL. Now, he had his, was it LCL, MCL, PCL, everything with an L already operated on once, and then things that I didn't even know existed, and yet he's going to have another surgery. Between the MCL and the LCL and now a second ACL, is it likely that his career is over?
I mean, that's a tough question. This is a real challenge. So he had what's called a multi-ligament injury to his knee. So that means more than just the run-of-the-mill ACL, which is what everybody hears about. So when you talk about tearing 2, 3, or even all 4 ligaments of your knee, I mean, you're already behind the 8 ball. His treatment was pretty standard, where we typically repair the outside ligaments, so the medial and the lateral, that's the MCL and the LCL. Those get fixed first. You get a period of rest, recovery, therapy, and then you go back in and you do the ACL reconstruction later. That's a common approach, and that's what he got. But anytime you're talking about multiple ligaments, I mean, the amount of stress and trauma that is on the body, the amount of injury that is to recover from, the outcomes just aren't as good as a primary ACL. And unfortunately, this is his second surgery. This is a real bugger. These are, even for the, lay athlete to get back on recreational weekend sports is a challenge. We're talking about this guy trying to get back to the highest level of performance. As I said before, these guys are cut from a different cloth and nothing's impossible. But I mean, I think we're looking at minimum 9 to possibly 12 months for him to get back on the field.
Wow.
Crazy. Doc, I probably should know this. You were in the service. What branch were you in?
Yes, sir. Retired Army.
Retired Army.
All right. Go Army.
No, go Navy, beat Army. We'll deal with that in December.
Yeah, exactly. Go Army, beat Navy.
Never. Appreciate you, Doc.
Yes, sir. Thanks so much.
Appreciate it. Dr. Christopher Tucker with the injury update powered by the Sports Institute at TSAOG Orthopaedics and Spine, online at TSAOG.com.